Wouldn't that be a more realistic way to go about explaining to people what exactly we are doing than the way that has been generally explained, which seems sort of vague? It's almost as though, well, we're gonna flatten the curve and then everything's going to go away by September, and that does lead to some pretty significant questions about the modeling.
Yeah, well, I mean, if you listen closely, I think it has been said by the White House task force, at least, and Fauci specifically, as well as Dr. Birx, that there is an anticipated second wave, if you want to call, or it is being thought of as, okay, we're probably going to get this somewhat like the flu in terms of seasonal, or at least again. So the real direction of health policy in this is twofold. It's not just not overwhelm the healthcare system. It's number one, to save lives, to protect the people who are going to die. And when we just looking at the New York data, okay, New York data alone, something like 1.5% of deaths are in people without any previous underlying condition. Okay, so that's very impactful on the decision making because we know who's going to die. There are exceptions. No one's saying there's no exceptions, but exceptions don't disprove the rule. So the number one goal is to stop people from dying. The number two goal is to make sure that we don't overwhelm the system so that we can take care of sick people and so that we don't endanger our healthcare provider network of doctors and nurses and respiratory therapists, et cetera. And so that, to me, I think the appropriate policy is to have isolation of the people who are vulnerable. I mean, in a very strict way, making sure that people understand that there is a strategic isolation going. That is the vulnerable and the people who interact with people who are sick. Everyone who's sick absolutely must assume, with or without testing, they should assume they have the virus and then proceed in an isolation mode for the 2 weeks that are recommended. And number three, a prioritization of testing. So that means who should be tested? People who are in the hospital, who have the symptoms and who are sick, make sure they do or do not have this so they can be isolated. People that are interacting with older people, like nursing home workers, people in the healthcare profession. That are taking care of patients. These people need to be tested. It's not true that there's this equally urgent need to test everybody immediately. That is not really, that's a bad message, I think, to send out. And the second thing to understand is that if you're sick and you're otherwise healthy, you don't need to go in to seek medical care. You can call your doctor, but if you just have a mild fever or a cough and you don't have shortness of breath or high fever, you should assume you have the virus and stay home. That prevents overwhelming of the system. There is no urgent need for testing of people just out of curiosity or fear. We should, if you're sick, again, assume you have it, be isolated. The goal here is to really stop the people from getting it who are vulnerable. There is a topic that I think is worth knowing about, which is this idea of herd immunity, which means that there's a societal benefit to have people who have the disease, meaning are carriers, sort of get it and develop their own immunity. And the more people that have that, the virus ultimately does disappear, as is the case for every other virus that we encounter. And, the other part of the equation that I didn't mention is that we should not underestimate the work being done on the drugs that are being used in clinical trials. And we will start seeing results this month, meaning within a couple of weeks, perhaps even within 1 week, I've been told, by one of the big companies testing the drug in clinical trials. And these drugs, the intravenous drugs, for instance, the Gilead drug, is a if it works, and there's plenty of reason to believe it will work. There's no guarantee, it's not proven, but it did work in other coronavirus models previous to this, in animal models. It does have safety profiles proven already. In fundamental biology, it should work. And if it works, it will save lives. And the other drug that we hear a lot about is the hydroxychloroquine, with or without the antibiotic azithromycin. And there is fundamental biology. It's not just some sort of strange anecdote report. There's fundamental reasons on the mechanism of action of the drug, why this will work. And so I think that's another cause for optimism. It's not a steady state here. I believe there's reasonable optimism to be held that we will be able to treat the disease. And given that, over time, that changes what happens next in terms of, let's just say this comes back next January, February. Okay, by then, it's very possible we will have drugs to prevent people from dying. And that changes the whole equation.
Thank you for tuning in to the Daily Wire, one of the fastest growing conservative media outlets in the country. If you enjoyed this video, be sure to give it a like and subscribe to our YouTube channel so you don't miss out on any of our content.